Hi viewers, how are you doing? Hi again. This is your lady honey Nyabbs. Back to you again. Yeah, because I really want to explain and complete this topic about loss. I introduced this topic like a week ago, hmm and I explained what loss is, and how people receive it. But I had told you I'll embark on the journey of explaining the stages that people pass through when they get a loss. Yeah. So there are several stages, but there are five stages that have been accepted. They are known to be the normal stages that people pass through. And these stages were brought by this person. There's a lady, a psychiatrist called Elizabeth Kula. She's a psychiatrist. She has an authority in this area of Death and Die, and she even wrote a book on that, Death and Die. And she came up with these stages. Yeah, she's a psychologist and she has dealt with patients. So she did a research. She came up with these stages. So they have been accepted as the stages that um, somebody goes through when they have been hit by a loss. Yeah, and a loss, as I told you, can be a loss of anything, can be a loss of your loved one. You can lose a job. You can lose friendship or a relationship. Children can also lose their peers. They can lose their parents. It's a loss of anything, a loss of your animals, a loss of your property, a loss on anything. So that is what I'm going to talk about, the stages that people go through. There are five of them. They are known and they have been accepted. And today I want to talk about the first one. So the five stages are known are denial, followed by anger, then bargaining, we go to depression, and the last one is finally accepting. Mhm. People go through, they might not go through the stages in that order, but they do go through the stages at some point after they have uh, been hit with the news of a loss. Mhm. I think the best way to explain denial in this video is to give you some examples that will make it very easy. So let's take an example of someone who has gone to the hospital for a normal checkup, a yearly normal checkup. Then later, when they're getting the results, the doctor says, "I'm sorry, you have been, what you have is stage 2 cancer or stage 3 cancer or stage 4 cancer." That was the first time you received this news. And this is the first, you were just going for a normal checkup. Yeah. So, of course, that is a shock that hits someone because they were not ready for this. Yeah, they were just going for a normal checkup. But most likely, a person will receive this news in denial. You know, they might even tell the doctor, are you sure my blood was not mixed up with other people's blood? Uh-huh. You can even say, the lifestyle that I've lived, I've not been careless. I have not even used so much sugar as the doctors say, or some of the things that the doctors normally say can contribute to having cancer. He said, I have been so careful, so I do not understand. They can be in denial. Yeah, that is the first reaction that comes to them. And they'll even go home, explain this, and say, I don't believe it. I think I have to go to another hospital. They go to another hospital, they are tested, the results come out the same. They say they deny, they say, let me look for a specialist to do this because I do not understand. I can't be having cancer. So they do that. So that's an example of denial. Yeah. Another example of denial is when you lose a job. Yeah. Maybe you were warned or you were just given a week or 2 weeks and told, our organization will be retrenching. Yeah, and our target is maybe those who are not so good in tech or a certain department. And maybe you're not in that department. But as the days move on, you're given a letter also. You're given a letter that you among the people who have been retrenched. Yeah. I mean, you say, no, 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 this is not true. Did they make a mistake? I mean, I'm not even in the departments that were mentioned. Yeah. I have a clean uh, record. Yeah. In my job, I do my work so well. I don't, you know, somebody will deny it. Yeah. They cannot, they don't see how they can be hit with that kind of news. So it's a denial. Yeah. Let's go to a case of somebody losing a loved one. Yeah. This happens a lot. Yeah. Let's say somebody died in an accident. Maybe there was a road accident or a plane accident, a plane crash, and then you're told some people passed on, some have survived. But there's reason to believe that your loved one was among the dead. So somebody say, no, 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 no. Who identified anyway? That person you're saying is my loved one. I don't believe it. I don't believe. I mean, there are others who are alive, so maybe my friend or my loved one could be among them. So they shield themselves, they deny it. And in most cases, you find that some people will not even believe it, even if they are the same people who took that person to the hospital, and the, after after they have been given that report that the person has gone, the person has passed, they will say, no, no, doctor, it can't be true. The person was talking. I brought the person here talking. Are you sure of what you're talking about? Have you checked? Is it this person? Is it what is happening? Yeah. That's why normally I think it's important. It's important that people view a body, especially the very close relatives to the person. I think it's important because this is like coming one on one with what you have lost. Yeah. And they see that this has happened. Even in case of a house, your house could be demolished because of one, two reasons, and you do not believe it. You are in shock. Maybe you are not there, but maybe when this person goes and sees actually the house is not there, maybe they could believe, but they will live in denial. Yeah, because they don't see. There was no cause for it to have happened to them. Yeah, and this you find those are a few examples of denial, and that is the first stage that someone goes through, especially when they have received news. Most people, this is the stages for everyone. I think denial is a normal a process that happens, and psychology says this is an important stage. Yeah, it's an important stage because it helps somebody not to deal with the whole pain, the whole amount of pain about on the loss at the same time. It is like somebody has put pain in a bag and dropped it on your door. But for you not to deal with the whole pain at a go, yeah, denial comes in, yeah. And with denial, you're able to deal with it little by little. You don't get the whole impact. Yeah, it's a psychological process because your brain is not ready. Your brain is not ready for to receive this news or even for the grieving process. Like if your loved one has passed on, a person you saw in the morning, a person you took to the hospital and left the person there, or you've been diagnosed with or something, and I mean it's you will deny it, and it is a process. It's a psychological process that helps um, people to lessen the impact of the pain. Okay, so that is the first stage, and almost all people pass through it. Yeah, and as I said, there are five stages that I'm going to talk about, and people might not go through them in that manner. It could even this denial might even come after the second stage, but the stages will be there. So just stay with me. In my next video, I'll be talking about anger, which is the second stage of grieving. I'll see you. Thank you.